Today I'll be running you through how to perform a cardiovascular assessment. Before the patient arrives, it's important to have all the equipment that you'll need ready to go. For a cardiovascular assessment, you'll need a sphygmomanometer, stethoscope, watch with a second hand, blanket, and alco wipes. Firstly, it's very important to introduce yourself to your patient and let them know what you'll be doing in order to gain consent. Good morning, my name is Madeline. I'm a student nurse and I'll be performing a few checks and asking you some questions in order to assess your heart and lungs. I'll explain each procedure beforehand, but if you have any questions, feel free to ask. Do you mind if we begin? Start by ensuring you're in a well-lit, private room where you won't be disturbed. Keeping the door closed is vital for maintaining privacy, but also to keep the room quiet. Tell the patient you'll be beginning by asking them a few questions about their and their family's history. Ask questions that will provide a full picture of your patient's cardiovascular history and make sure you record all the answers as appropriate. By conducting the interview first, you will have begun to build trust with the patient and hopefully they are relaxed. This would have taken a few minutes, so now is an appropriate time to take a blood pressure reading. Perform hand hygiene in the room and explain that you would like to take the blood pressure, and in order to do this, the upper arm needs to be exposed. This is a great time to check if the patient is comfortable and offer a blanket if they get cold. Ask them to sit upright if they are not already. Record systolic and diastolic readings, clean the equipment, including alco wipes on the earpieces. You can now explain the next few procedures to the patient. Now I need to focus on your heart. I'll feel for an apical pulse just at the base of your heart, visually inspect for pulsations, as well as listen to your heart through the stethoscope for a few different places for extended periods. You must now ask the patient to remove all clothing from their torso. A blanket should be provided so your patient doesn't get cold and to protect the patient's privacy and dignity. Once the patient is ready, get them to either sit upright or in the supine position, whatever is most comfortable. Start by inspecting the anterior thorax. A visible pulsation of the mitral area is normal in about half the population, but anywhere else should be reported as it can indicate aneurysm or an enlarged ventricle. Now let the patient know you'll be feeling for the apical pulse. Warm up your hand and pinpoint the pulse with one finger pad. A pulse that is extremely strong or not in the right place needs to be reported. Next, let the patient know you'll be using the stethoscope to listen to your heart. Again, it's a good idea to warm up the stethoscope to make the patient more comfortable and it shows concern. Listen to the apical pulse for 1 minute for rate and rhythm. If the rhythm is irregular, see if there's a pattern. Anything unusual such as dysrhythmia, bradycardia or tachycardia must be reported. Document the pulse rate and rhythm. Now identify the cardiac auscultation sites by using either the traditional cardiac landmarks or heart chambers. Position the diaphragm end at the base of the heart and inch it across in a Z shape, across and down the apex, listening for 10 to 15 seconds at each area. Listen carefully to the S1 and S2 sounds. If anything abnormal is heard, such as murmurs, rubs, or sounds that are in an unusual place, these must be reported. Be sure to document the normal S1 and S2 sounds. Having finished examining your heart now, you can redress. Thank you for your patience. Once they're dressed and comfortable, the last thing we need to examine is your vascular system. So I'll check the pulse at your extremities and have a look at your hands and feet, as well as feel some arteries around your neck. Is that okay? Assist the patient to supine position with the head of the bed raised to 45 degrees. Inspect the right carotid artery. Ask the patient to turn their head to the right. Palpate the carotid artery, checking the pulse rate and rhythm. Auscultate the carotid artery and repeat on the left side. Next, inspect and palpate the jugular vein. You will now inspect the pulse bilaterally and simultaneously at the radial, posterior tibialis, and dorsalis pedis. Ensure each pair is equal in volume, rate, and rhythm. Inspect both arms and hands as well as legs and feet for signs of poor perfusion. These can include cool digits, shiny hairless skin, or discoloration. Next, assess the speed of each extremity's capillary refill. Let the patient know you'll squeeze the nail bed of a few fingers and toes of each limb. Colour should return within 3 seconds. Now assess bony areas of the peripheries for edema, including the top of the foot and ankle, by firmly pressing down with each finger. No indent should remain. Inspect the fingers for clubbing. Now document all inspections and their results. Clean the bell and the diaphragm, as well as the earpieces and the stethoscope with alco wipes. Let the patient know you're finished and thank them, and finally perform hand hygiene.
Created using Powtoon.